Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Kwara State gets support from U.S. Centers for Disease Control to achieve 50% vaccination coverage. Edo records drop in new infections but stops short of declaring fourth wave over. And France's authorities express cautious optimism for peak of current wave following a drop of cases in some cities. Thank you for joining us. At least one person has died of COVID every 12 seconds in the past week. And this is according to the WHO Director General, Dr. Tedros Ghebreyesus, in his opening remarks at the 150th session of the Global Agency's Executive Board in Geneva, Switzerland. He says it has been 2 years since the organization declared COVID a global health emergency, adding that more than 350 million cases have now been reported. On the vaccination drive, the World Health Organization, DG, says that 34 member states, mostly in Africa and the Eastern Mediterranean region, have not been able to vaccinate 10% of their populations, while 85% of the African population is yet to receive a single dose of the COVID-19 vaccine. In the meantime, in Nigeria, the NCDC reported 2 deaths from COVID-19 complications, increasing the fatality toll to 3,126. Here's more on the pandemic update.
241 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT. That's an increase from figures reported earlier. Taraba accounted for the highest number of cases with 98 infections. Rivers had 66. Lagos 35, FCT 20, while Delta registered 13 cases. Kwara, Abia, Nasarawa and Plateau states logged single-digit infections. The total confirmed cases in Nigeria now stands at 252,428. The report also includes a backlog of confirmed cases from Taraba State and 0 cases from Cross River, Ekiti, Kano, Ogun, Ondo, Osun, Oyo and Sokoto states. 596 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 227,004. There were 2 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,126. Currently, there are over 22,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by the FCT and Oyo State. Almost 14 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 5.2 million of the population have been fully vaccinated. The total global confirmed cases have surpassed 354 million, while deaths are beyond 5.6 million.
The United States of America is assuring the Kwara State government of its readiness to partner with the state to ensure that 50% of the state's eligible population are vaccinated against COVID-19. The Director of Immunization, U.S. Centers for Disease Control and Prevention, Dr. Bulu Omotayo, gave this assurance on a courtesy visit to the Deputy Governor of the state in Ilorin. At the moment, Kwara is on the top 5 performing state on the National Primary Healthcare Development Agency COVID-19 vaccination list, but only 20% have taken their first dose.
This team from the United States Center for Disease Control and Prevention is in Kwara State to offer assistance to the Kwara State government to ensure that more people are vaccinated against COVID-19 as soon as possible.
2 states in the country was going to be supported for the COVID-19 vaccination, and Kwara State was selected to be one of the beneficiaries of this support. The support will involve that 8 of our local government areas is to be supported, and that has commenced because training, selection, and training and deployment has taken place in the last 2 weeks. And currently, you would notice that We have additional teams that have been deployed across these 8 selected local governments in the state.
Kwara was chosen because of qualities the U.S. team noticed in previous engagements.
Kwara State was selected because we know we would have the leadership, we would have the support, we have the wherewithal, and the ability to do it. We believe that getting to 50% coverage, Kwara State is actually not going to get to 50% coverage for COVID-19 vaccination, but you will surpass it.
The U.S. aid representative is grateful for the support, and the deputy governor asked for more to encourage vaccine acceptance.
We thank you very much for your support of those projects. They're very much in line with supporting our HIV, AIDS, and tuberculosis portfolio, which has been very prevalent here in the state. But in addition, we're also leveraging that supply chain and logistics support to be able to support the COVID-19 vaccinations here in Kwara State.
We thank you for coming to us here in Kwara State to help us with the vaccination. We need more. We'll come to you like over 2 years to ask for more. A lot of people still don't believe in taking the vaccination. Even people who are educated, they don't believe in it, so we have to create more awareness, tell them why they have to do it.
According to the Executive Secretary of the State Primary Healthcare Development Agency, Kwara is among the top 5 states in COVID-19 response, with 19% of the target population vaccinated. Prior to this collaboration, the U.S. CDC team has been helping the state with routine immunization and polio eradication.
And the COVID-19 incident manager in Edo State, Dr. Andrew B., has disclosed that the state has been recording a progressive drop in the number of cases in the last 4 weeks, noting, however, that the 4th wave is yet to end. He also highlighted the need for continued research on the possible drivers of the reduction, just as he underscored the importance of following the non-pharmaceutical interventions to keep safe from the virus.
In the past 4 weeks, we have had progressive weekly drop in number of cases in the state, and just for last week we had only 25 cases, the week before 46. The numbers have been dropping significantly, and the indication is that our test positivity rates are also dropping, which is suggestive to a large extent that we are towards the tail end of the 4th wave. But we are not in a hurry to make that decision. Over the next 2 weeks, which coincide with the full incubation period of the corona outbreak, we'll be able to have more precise details in terms of whether we have successfully contained the outbreak. But it's important to note that our test positivity rate has dropped significantly. We are not resting on our oars. Our response mechanisms are fully alert. Surveillance activities are still ongoing across the 18 LGAs of the state. At the entry points, especially at the airports, we are carrying out major interventions, vaccination drive across the state, which we know are very, very effective mechanism in helping us contain infectious disease outbreaks such as coronavirus.
Now, studies are underway to find out the precise characteristics of the latest COVID-19 variant, BA2, which already accounts for a majority of most recent cases in a number of countries, including India, Sweden and Denmark. So far, experts believe the vaccines are effective and hospitalization levels apparently unchanged, but they say there is a possibility it might be more transmissible. Well, joining us to talk more about this, Dr. Akiala Ishaku, a virologist. He joins us on the program. Thank you for joining us. I'd like to begin. There is the suggestion by some experts on the new variants we're so far registering that there really is no cause for concern, or that is rather so much hype, as nothing is certain yet about any of the variants. And we're talking about the IHU, the Demicron. Would you also say the same for the BA2?
So thank you, Millicent, for having me. Actually, there has been increase in the number of cases of this subvariant. In the UK, there are 400 cases that were discovered. They were also discovered in India, in Singapore, and in Denmark through genomic surveillance and sequencing. What is quite key about this subvariant is that it does not bypass the vaccines that we have available. So we have the BA1, BA2, and BA3. The differences between BA2 and BA3 from the BA1, which is the Omicron variant, is that there are change in sequences of the amino acids. There has been increase in prevalence rate of these subvariants, but there are no increase in number of new cases, and also there are no increase in number of hospitalization due to this subvariant. So it does not call for too much panicking, but it calls that we need to be very active in terms of our genomic sequencing. Another thing, again, we should be a bit worried about the BA2 is that you cannot be able to dictate it through the normal real-time PCR. You have to also dictate it through genomic sequencing. Not all countries that are, constrained by limited resources have the capacity for genomic sequencing. So it calls for us to be actively active in our genomic sequence as a country and as Nigeria.
So it's not easy to trace, but what can you tell us about the potential that it may be more, even much more transmissible than the Omicron itself?
Yeah, absolutely. So countries of the world, country like United Kingdom, Canada, India, have actually done a lot of studies on this subvariant, and they have discovered that the transmissibility rate is not as high as that of BA1, that of the main Omicron. So it does not call for concern. The transmissibility is a bit low, despite the transmissibility is high, but the hospitalization rate and rate of infection is a bit low. So it does not call for concern, although it is a new subvariant that is new, and a lot of genomic studies is being done on the subvariant. So for now, increase in prevalence rate of this subvariant, but decrease in new infection rate and hospitalization and death rates.
Also, we understand the BA2 has been nicknamed Omicron's little brother. Perhaps one other question is how you can actually differentiate the two. But I'd like to ask, to really discover variants, there needs to be continued genomic surveillance and sequencing, which allows detection. But is any of that taking place in Nigeria? And this is not to say we've registered any of these new variants, but then how often would you recommend that we also take part in observing and monitoring some of these variants?
Absolutely, Melissa. We have the capacity for genomic surveillance in Nigeria. It is being done in few centers like the Redeemer University in Ede, African Center, Excellence Center for Infectious Disease and Genomic Studies, even in 9 Mile, Lagos. But genomic surveillance should be a daily activity. A lot of samples that we get from states that are positive, they should be logged into the central reference lab where most of these genomic surveillance are taking place. Melissa said, I would recommend that every geopolitical zone, every state can also have a kind of a sequencing machine. This is because it is not only limited to COVID. We have a lot of issues of antimicrobial drug resistance on a high increase in our continent. So not only viruses mutate, also bacteria mutate, and also fungi and a lot of infectious agents. So I want to say that there is need for us to have more centers and begin to come up with genomic sequencing or genomic surveillance consortium. Melissa said, I think we just need to also have, as a nation, the first COVID-19 national summit. We need to bring a lot of research that has been done and come together and discuss on the impact of this and what have we discovered, what lessons have we learned, and what is the way forward. So we need to come on a national discourse to have conversation and how we can also be able to include other infectious diseases. So we are battling with cholera. Very soon we'll start battling with meningitis, and Lassa is with us. So we need to see how we can have an integrated surveillance system that it can be able to co-opt virtually all these infectious disease agents and then begin to move forward. So in coming months to come, I want to prescribe to the Presidential Task Force to come up with the first national international conference on COVID-19.
All right. We always appreciate your time on the program. Many thanks, Dr. Akiela Ishaku, as a virologist, joining us this evening. Thank you again.
Thank you for having me.
We have more on the COVID-19 updates, especially from the international scene. Do join us again. The U.S. Centers for Disease Control, as of yesterday, reported 251 million people have received at least one dose of the COVID-19 vaccine in the United States. Of those, 210.5 million are fully vaccinated, and more than 84.3 million people have received a COVID-19 booster dose. However, some Americans continue to protest vaccine mandates as the U.S. enacts vaccine initiatives to curb the spread of the coronavirus, as well as providing over 400 million N95 masks free to the public. Our Washington correspondent, Maria Bird, brings us more.
Despite the havoc that the COVID-19 Omicron variant has caused in the U.S., infectious disease experts are anticipating that Omicron will not dominate life in the U.S. in 2022. Within the past week, there has been a reduction in COVID-19 cases in 19 U.S. states, Washington, D.C., and Puerto Rico. This is positive movement after an aggressive winter spike in COVID cases at the onset of the season. The White House Coronavirus Task Force has released data that suggest that the booster vaccination vastly decreases the possibility of one having to be hospitalized or visit the emergency room if they test positive for the Omicron or Delta variant.
In general, we see lower overall vaccine protection against Omicron, as we saw against the Delta variant shown by the blue line, especially with just 2 doses of an mRNA vaccine. For those who received the first 2 doses, vaccine effectiveness was 38% against emergency room visits and urgent care visits after 6 months. However, vaccine effectiveness increased up to 82% for those who received their booster dose. Similar as to seen with emergency department visits on the prior slide, for both the Delta and Omicron variant, there was a decline in vaccine effectiveness against hospitalization over time. But following a 3rd dose, vaccine effectiveness against hospitalization with Omicron increased to 90%, nearly matching the effectiveness against the Delta variant and even higher than vaccine effectiveness after the first 2 doses of the mRNA vaccine.
In addition to the increased efficacy of the vaccine with a 3rd dose, experts believe that the increase in testing is another mitigating factor in combating the virus.
And we're currently processing 100,000 samples per day with less than 24-hour turnaround time.
Let's rethink the whole process and say, how do you do this at really high volume and high scale? And so that sample tube that we collect in the field goes nearly straight from the field into our automation instead of a bunch of handling manipulation by the lab staff. We're able to just take them in from the field and drop it into the automation. There's definitely a place for antigen testing. We think it's a piece of the solution. The downsides with antigen testing is just not nearly as sensitive as what we're able to do here with PCR testing. And what that ultimately means is we're able to pick up infections in people days before they show up on an antigen test.
While the peak of the recent wave of COVID-19 may be ending in the U.S., experts believe that the only way to continue with a decrease in daily cases is through vaccinations, continuing to wear masks, and frequent COVID-19 testing. From Washington, Maria Bird, Channel Television News.
Well, joining us for more on the situation in the U.S. is Dr. Mercy Edionwe, hospitalist, joining us from Texas. Welcome to the program.
Welcome. Thank you, actually.
Thanks. Omicron, we understand, has now peaked in the US. And do you agree, especially, what are the numbers saying in your region?
Well, yes, we are definitely seeing a decrease in cases. In Houston, where I'm actually practicing, there has been actually a decrease. It went from 13,000 cases a day down to 9,000. So we have peaked, but it's still high cases. And so we definitely still need to do our preventative measures to combat this COVID-19. We're still seeing high cases coming into the hospital and hospitals full of COVID-19 patients.
We also understand the CDC announced U.S. travelers to avoid some countries. And I mean, the question was, will they listen? Do you think that people care with COVID and the way it's spreading?
Well, that's a very good question. There is COVID fatigue that is rampant around these parts of the country. I mean, you have to understand, COVID first hit the United States January 21st, 2020. That was when we had our first case. And so we've literally been in COVID season for about 2 years. So we have seen increased numbers of travelers, according to the TSA, which is our Transportation Security Administration. We've seen an increase. They compared to last year, like it was about 700,000 per day of travelers. Now it's 1.3 million, but it's still not up to the 2 million that we saw prior to COVID. I just think that people are traveling because they are tired of being at home, but there are preventative measures that they can travel safe now.
How much would you say rapid diagnostic test kits have actually helped reduce the spread of COVID-19 in the US?
Yes, I definitely do. I definitely think it's one of the preventative measures that we are using. If you recall, previous, like last year or even the years before, one of the reasons why there was a spread in cases is because there was no access to COVID rapid testing. Now that the President, Joe Biden, has now mandated that there should be more rapid antigen tests in the country, we're seeing more and more people able to now be able to know their COVID status and either get quick treatment or quarantine themselves. And this will lead to a decrease in the number of transmissions. So yes, I definitely am happy that that is one of our ways that we're reducing the number of COVID transmission rates here in the US.
But do you also think that learning to live with the virus is perhaps a technique that the US CDC is looking at and the Biden administration in any way, perhaps just like countries like the UK is doing?
Come again, can you say that one more time? I'm sorry.
So I'm asking that, do you think learning to live with the virus, which is what the UK is sort of doing with, you know, the markets recorded in vaccination and tests and the boosters, is the US adopting that or still working to try to reduce the virus to the barest minimum and try to get more people vaccinated?
Yes, I think that learning to live with the virus is key and important. And I think we are here in the US trying to do such things. I mean, we haven't had a lockdown as a result of what we've learned from having previous lockdowns. It doesn't necessarily decrease significantly the spread of COVID-19 and the way it affected businesses and economies. We're now learning, okay, what are other ways, what are other preventative measures that we can use to help reduce the COVID-19 spread? You know, as I'm seeing now, the society is just opening up, and, you know, we're modifying what we're doing as a society to circumvent having increased numbers, but, you know, we're learning.
Oh dear, we appear to have lost Dr. Mercy Dionwe, but we'd like to thank her. Thank you. Dr. Mercy Dionwe is a hospitalist, and she's been joining us from Texas, Houston, Texas, in the US. Well, people who aren't vaccinated against COVID-19 are no longer allowed in France's restaurants, bars, tourist sites, sports venues, unless they recently recovered from the virus. The new law came into effect Monday, requiring a vaccine pass that is central to the government's antivirus strategy. France is registering Europe's highest ever daily coronavirus infection numbers, and hospitals are continuing to fill up. Here's more of the global COVID-19 update.
Over in Europe, France's Health Minister Olivier Véran says he hopes France would reach the peak of the current COVID-19 wave in the next few days. He says the country had overcome the wave of the Delta variant, and that some regions, such as Paris, were seeing a decrease in daily infection numbers for the highly contagious Omicron variant. Israel's health ministry says a government panel has recommended offering a fourth COVID-19 vaccine dose to all adults on condition that at least 5 months have passed since they received the third or recovered from the illness. Implementation of the measure, which would significantly expand eligibility, now limited to the over 60s and other high-risk groups, is subject to approval by the ministry's Director General. It is not clear when that might happen. Finally, over 200 South Korean small business owners shaved their heads in Seoul today to protest the government's extension of curfews and restrictions amid growing coronavirus cases brought about by the fast-spreading Omicron variant. Business owners, some in tears, had their heads shaved on a makeshift stage and under a large banner reading actual compensation for losses caused by COVID-19 just near the country's National Assembly.
The situation around the globe. Well, you can visit our website, channelcv.com. It has more updates. You can also find a better understanding of the pandemic, plus other stories at your fingertips. That's the program this evening. Thank you for watching. I'm Melissa Walker. Stay healthy.